Welcome to a new video, and thanks for being here today. Walk into any senior center, nursing home, or geriatric medical office, and you'll likely hear the same advice repeated: make sure you're drinking enough water. This seemingly simple recommendation has become a universal mantra in elder care, but few understand the complex physiological reasons behind it. Today, we're diving deep into why hydration becomes increasingly critical as we age, and it goes far beyond the general advice given to the broader population. In this video, we'll explore the fascinating science behind age-related changes in hydration. You'll discover why older adults face unique hydration challenges, how these changes impact nearly every system in the body, and what makes proper hydration perhaps the single most underappreciated aspect of geriatric health. What's particularly important to understand is that the consequences of inadequate hydration in older adults are far more serious than most realize. Research shows that even mild dehydration affects seniors differently than younger adults, with implications for cognitive function, fall risk, medication effectiveness, and even hospital readmission rates. As we explore this topic, remember that individual health needs vary, and the information shared today should complement rather than replace personalized advice from healthcare providers familiar with your specific situation. Let's uncover the real reasons behind this critical health recommendation for our older population. The aging thirst response. When your body stops telling you to drink, the most fundamental reason doctors emphasize hydration for older adults stems from a well-documented physiological change: the diminished thirst response that occurs with aging. Unlike younger adults who feel thirsty when their bodies need water, many seniors simply don't receive this crucial biological signal. The science of declining thirst sensation research, published in the journals of gerontology, found that adults over 65 showed significantly reduced thirst sensations compared to younger adults when subjected to the same level of dehydration. In a landmark study, when both older and younger participants were deprived of fluids for 24 hours, younger participants reported intense thirst and consumed more water when allowed to drink, while older participants reported minimal thirst despite having similar or greater levels of dehydration as measured by blood tests. This change occurs because the hypothalamus, the brain's thirst center, becomes less sensitive to the hormonal and neural signals that typically trigger thirst. Additionally, age-related changes to baroreceptors, pressure sensors in blood vessels, reduce their ability to detect the lower blood volume that occurs during dehydration. The practical implication is profound. Many older adults simply don't feel thirsty, even when their bodies urgently need hydration. This means relying on thirst as a hydration guide, which works reasonably well for younger people, becomes dangerous after a certain age. Beyond thirst, decreased total body water. Compounding this reduced thirst response is another age-related change. Older adults naturally have a lower percentage of water in their bodies. Research published in the American Journal of Physiology shows that while younger adults' bodies consist of approximately 60% water, this percentage drops to 50% or lower in many people over 65. This decline occurs because muscle mass decreases with age. Muscle tissue contains more water than fat tissue. Kidney function naturally declines, affecting fluid regulation. Hormonal changes alter how water is distributed and retained in the body. This lower water reserve creates a smaller margin of safety when fluid intake decreases or fluid losses increase. In practical terms, it means that older adults become dehydrated more quickly than younger people when they don't drink enough. Real-world consequences. The combination of diminished thirst sensation and lower body water percentage explains why an estimated 40% of elderly admitted to hospitals show signs of dehydration upon arrival, according to a study published in the Journal of the American Geriatric Society. More alarmingly, research from the International Journal of Nursing Studies found that elderly patients admitted with dehydration had a mortality rate approximately 17% higher than those admitted for other causes. For these physiological reasons alone, physicians emphasize proactive hydration for older adults, drinking according to a schedule rather than waiting for thirst. But this is just the beginning of understanding why proper hydration becomes increasingly critical with age. Medication effectiveness and safety, the hidden hydration connection. Perhaps the most overlooked reason doctors emphasize hydration for older adults relates to medication effectiveness and safety. With more than 40% of adults over 65 taking 5 or more prescription medications, according to the Journal of the American Medical Association, the interaction between hydration status and pharmacology becomes critically important. How dehydration alters drug concentration and function research published in the Clinical Pharmacokinetics Journal demonstrates that even mild dehydration significantly alters how medications are absorbed, distributed throughout the body, and eliminated. When an older adult is inadequately hydrated, blood concentration of water-soluble drugs increases, potentially reaching toxic levels even when taking the prescribed dose. Kidney filtration decreases, extending the half-life of many medications. Absorption rates change in the digestive tract, making medication timing and effectiveness less predictable. A study from the American Journal of Medicine found that among seniors taking cardiovascular medications, including diuretics and ACA inhibitors, those with inadequate fluid intake were 2.5 times more likely to experience adverse drug reactions than those who maintained proper hydration. The vicious cycle of medication and dehydration. Many medications commonly prescribed to older adults contribute to fluid loss or reduced fluid intake. Diuretics, water pills, increase urinary output. Many blood pressure medications promote fluid excretion. Some laxatives draw water from the body into the intestines. Certain antidepressants and antihistamines cause dry mouth, discouraging drinking. This creates what geriatricians call the medication dehydration cycle. A senior takes medications that increase fluid loss, becomes dehydrated, experiences altered medication effects due to that dehydration, and potentially requires additional medications to address these new problems. Breaking this cycle requires proactive hydration, precisely what doctors emphasize when they insist that elderly patients drink more water. This isn't just general health advice. It's a specific medical intervention to ensure medications work as intended and don't cause harm. If you're finding this information valuable, please consider subscribing to our channel for more evidence-based content on aging well. Your support helps us continue producing videos that blend scientific accuracy with practical guidance for older adults and their caregivers. Now let's continue exploring why proper hydration becomes increasingly vital as we age. Cognitive function, the brain-water connection. When doctors emphasize hydration for older adults, they're also protecting cognitive function, an aspect of hydration that receives far too little attention in general health discussions. The evidence, how hydration affects thinking and memory. Multiple studies have demonstrated a clear relationship between hydration status and brain function in older adults. Research published in the International Journal of Psychophysiology found that even mild dehydration, just 1 to 2% of body weight, impaired working memory, attention, and executive function in seniors. More dramatically, a study in the American Journal of Clinical Nutrition involving adults 60 and older found that those with better hydration, as measured by plasma osmolarity, performed significantly better on tests measuring information processing speed, attention and focus, memory, recall, problem-solving ability. The relationship was dose-dependent. The more hydrated the individual, the better their cognitive performance. The physiological mechanisms. How exactly does hydration affect brain function? Several mechanisms have been scientifically documented. Brain volume changes. Even mild dehydration causes measurable brain tissue shrinkage. A study using advanced MRI techniques published in Neuro Report found that brain tissue fluid actually decreases during dehydration, temporarily reducing brain volume and increasing ventricular space. Neurotransmitter function. The concentration and function of neurotransmitters, the brain's chemical messengers, are directly affected by hydration status. Research in physiological reviews demonstrates that dehydration alters the concentration of electrolytes in and around neurons, affecting how they communicate. Cerebral blood flow. Dehydration reduces blood volume, leading to decreased cerebral blood flow. A study in the Journal of Applied Physiology found that even 1.5% dehydration reduced cerebral blood flow by approximately 10% in older adults. For older adults already experiencing age-related changes in brain function, these hydration-related effects can make the difference between independence and requiring assistance. This explains why many memory clinics and cognitive health specialists emphasize hydration as part of their treatment plans. Fall prevention, the surprising role of hydration. When geriatricians insist older patients drink more water, they're also addressing one of the most serious health risks in aging: falls. The connection between hydration and fall risk is supported by substantial research, but rarely communicated effectively to older adults and caregivers. Hydration and orthostatic hypotension. One of the most direct links between hydration and falls involves orthostatic hypotension, a sudden drop in blood pressure when standing up. Research published in the journal Age and Aging found that adequate hydration significantly reduced episodes of orthostatic hypotension in older adults. This occurs because proper hydration maintains blood volume. Sufficient blood volume helps maintain blood pressure when changing positions. Stable blood pressure prevents the dizziness and lightheadedness that lead to falls. A study following nursing home residents found that a structured hydration program reduced fall incidence by 21% compared to standard care, with orthostatic hypotension identified as a key mediating factor. Muscle function and coordination beyond blood pressure effects. Hydration directly impacts muscle function and coordination. Research in the Journal of Sports Sciences demonstrates that even mild dehydration reduces muscle strength, particularly in lower extremities. Reaction time when balance is challenged. Coordination during complex movements. For older adults already experiencing age-related declines in muscle mass and neurological function, dehydration compounds these issues, creating a perfect storm of fall risk factors: electrolyte balance and neurological function. Proper hydration is essential for maintaining the electrolyte balance that supports neurological function, particularly in terms of balance and coordination. A study in the Clinical Journal of the American Society of Nephrology found that imbalances in sodium and potassium, often caused or exacerbated by dehydration, were associated with increased fall risk in community-dwelling older adults. Given that falls are the leading cause of fatal and non-fatal injuries among older adults, according to the Centers for Disease Control and Prevention, the hydration-fall prevention connection represents one of the most compelling reasons why doctors emphasize fluid intake for seniors. Kidney function and urinary health. As we age, kidney function naturally declines, a process that both affects and is affected by hydration status. By age 80, many adults have lost 30 to 50% of their kidney function compared to age 30, according to research published in Nephrology Dialysis Transplantation. Preventing acute kidney injury. One critical reason doctors emphasize hydration is to prevent acute kidney injury, AKSI, a sudden decline in kidney function that becomes increasingly common with age. Research in the Clinical Journal of the American Society of Nephrology found that dehydration is the leading precipitating factor for AKI in older adults. Proper hydration maintains adequate blood flow to the kidneys, provides sufficient fluid for waste filtration, reduces the concentration of potentially harmful substances being filtered. A prospective study published in the Archives of Internal Medicine found that hospitalized older adults who received proactive hydration had a 39% lower risk of developing AKI compared to those receiving standard care. Urinary tract infections and prevention. Urinary tract infections, UTIs, affect up to 10% of men and 20% of women over age 65 each year, with the risk increasing dramatically for those in long-term care facilities. Research published in the Journal of Gerontology and Geriatrics found that increased fluid intake was associated with a significant reduction in UTI recurrence in elderly patients. This protective effect occurs because adequate hydration increases urine volume. Higher urine output helps flush bacteria from the urinary tract. Dilute urine creates a less favorable environment for bacterial growth. For older adults, UTIs often present atypically with confusion, agitation, or lethargy, rather than the typical urinary symptoms, making prevention through hydration even more critical. Kidney stone prevention. The incidence of kidney stones increases with age, affecting approximately 10% of adults over 70. Multiple clinical trials, including a landmark study published in the Journal of Urology, have demonstrated that increased fluid intake reduces kidney stone recurrence by 30 to 50%. This represents another compelling reason why physicians emphasize hydration for older adults, particularly those with a history of kidney stones or urinary tract issues. How much water? Practical guidelines for older adults. With all these critical reasons to maintain hydration, the practical question becomes, how much water should older adults drink? While individual needs vary based on weight, activity level, climate, and health conditions, research provides some evidence-based guidelines. Evidence-based recommendations. The European Food Safety Authority and National Academy of Medicine have established general recommendations that can be adapted for older adults. Approximately 2 to 2.5 liters, 8 to 10 cups, of total water daily for women over 65. Approximately 2.5 to 3 liters, 10 to 12 cups, of total water daily for men over 65. However, research published in the Annals of Nutrition and Metabolism suggests older adults should focus more on consistent patterns than on specific volumes. Their findings support drinking smaller amounts more frequently throughout the day, ensuring morning hydration after overnight fluid losses, extra attention to hydration during and after physical activity or in hot weather. Remember that these guidelines include water from all beverages and moisture-containing foods, which typically provide about 20% of total daily water intake. Practical implementation strategies. Research in the Journal of the American Geriatric Society has identified effective strategies to improve hydration in older adults. Visual cues. Keeping water visible in clear containers increases consumption. Scheduled drinking. Setting specific times for hydration, independent of thirst. Flavor enhancement. Adding natural flavors increases voluntary fluid intake by up to 50% in older adults. Social facilitation. Hydrating during social activities increases total fluid consumption. For those caring for older adults with cognitive impairments, regular offering of fluids at consistent times has been shown to be more effective than simply making fluids available. Conclusion: hydration as preventive medicine. When doctors insist that elderly patients drink more water, they're not simply repeating generic health advice. They're prescribing a powerful preventive intervention based on extensive research and clinical experience. Proper hydration addresses multiple age-specific physiological changes and health risks simultaneously. It compensates for the diminished thirst response that occurs with aging. It helps maintain medication effectiveness and safety. It supports cognitive function and brain health. It reduces fall risk through multiple mechanisms. It preserves kidney function and prevents urinary issues. It supports digestive health and reduces constipation. What makes hydration particularly valuable as a health intervention for older adults is its simplicity, safety, and cost-effectiveness. Unlike many medical interventions, increasing water intake, when appropriate, carries minimal risk of side effects, costs almost nothing, and can be implemented without complex medical supervision. The challenge, however, lies in changing habits and overcoming the reduced thirst sensation that makes adequate hydration counterintuitive for many seniors. This explains why doctors and caregivers must be persistent about hydration. The body's natural reminder system is no longer reliable. Yet the consequences of inadequate hydration become more serious with age. For older adults and those who care for them, understanding these physiological realities transforms drinking water from a casual health recommendation into an essential daily practice. It's not about following arbitrary rules, but about addressing specific age-related changes that affect nearly every system in the body. Thank you for watching this video. If you found this information valuable, please subscribe to our channel for more evidence-based content on healthy aging. Your engagement helps us continue providing science-backed information that can make a real difference in quality of life for older adults.